When this cuff tightens, it usually signals a lifelong reliance on prescription pills. However, managing high blood pressure can start with a different approach. Clinical data from the Cleveland Clinic establishes a baseline for hypertension management. Success depends on 70. This animated diagram illustrates a direct biological exchange. Losing exactly 1 kilogram of body weight results in a 1-point drop in your blood pressure reading. Step 2 moves from the scale to the dinner plate by adopting the DASH dietary pattern. DASH stands for Dietary Approaches to Stop Hypertension. A DASH-compliant meal looks like this generated image, emphasizing a high volume of fruits and vegetables in a Mediterranean style. This dietary pattern relies on moderation, focusing on balance rather than the total deprivation of specific food groups. Aligning your body weight with this specific plate composition creates the foundation needed for the rest of the protocol to work. Step 3 sets a strict daily sodium cap. This gauge identifies 2,300 milligrams as the target. Higher puts you in the danger zone. While some suggest a lower limit of 1,500 milligrams, sticking to 2,300 prevents diet burnout while effectively lowering your pressure. It is a common misconception that boutique salts are safer. As this equation shows, table salt, sea salt, and pink Himalayan salt are biologically identical. They all elevate blood pressure. Controlling your sodium is a powerful intervention. Consistently hitting this target has the same biological effect as taking 1.5 to 2 prescription medications. Sodium also has an inverse relationship with potassium. While you lower your salt intake, you must ensure your diet is replete with potassium to help drive your blood pressure down. Be aware that increasing potassium is dangerous for anyone with chronic kidney disease, as the body cannot process the mineral correctly. This is why a kidney function check is a prerequisite for this protocol. For those with healthy kidneys, the mathematical management of these two minerals is the most potent non-pharmaceutical tool available. Step 4 requires blocking out 150 minutes of aerobic activity on your weekly calendar. Intensity matters. You are aiming for the moderate zone, which means a brisk walk or a light jog rather than an all-out sprint. Step 5 adds 2 to 3 sessions of light resistance training to your week, using weights or resistance bands. Maintaining muscle mass is a biological necessity. As we age, muscle loss contributes directly to blood pressure spikes, and resistance training is the only way to counteract that trend. With your activity scheduled, Step 6 addresses the final chemical limit required for cardiovascular health. Alcohol intake must be strictly limited. For women, the daily maximum is exactly 1 drink. For men, the limit is 2. Scheduling consistent, moderate physical activity while capping chemical stressors creates an environment where high blood pressure cannot thrive. You now have your 6-step checklist: a weight loss target, a DASH diet foundation, a 2,300 milligram sodium limit, high potassium intake, 150 minutes of aerobic movement, and a strict alcohol cap. These steps have a massive compounding effect. Executing this routine every week provides the same biological benefits as blood pressure medication. Print your new weekly schedule and begin tracking your blood pressure every morning to monitor the downward trend. Once you have several weeks of lower readings, consult your primary physician. Use this data to negotiate a safe reduction in your medication dosages. Reclaiming control over your daily schedule is how you reclaim control over your cardiovascular health.